Hi, my name is Ethan Barton. I'm a student at the University of South Alabama in the nursing program, and today I'm going to be performing a wet to dry dressing change. Here is my ID. This is in place of a nursing ID because I have not been able to obtain my ID yet because of the hurricane. So now I'm going to verify the patient care order form and hospital policy, which requires a normal saline wet to dry dressing change to the hip every 4 hours. I'm going to position my supplies. I already have them together. Then I'm going to perform hand hygiene using antiseptic hand rub. Now I'm going to identify the patient using two identifiers, which will be the birthday and the medical record number. The date of birth is 8/25/1963, and the medical record number is 417-6352. Excuse me. So now I am going to explain the procedure to the patient. Mr. Jones, today I'm performing a wet to dry dressing change on you, and I will do this ensuring privacy, maybe by closing a curtain for you. Now I'm going to verify any allergies the patient might have, which is penicillin. Next, I'm going to reposition my trash can, make sure I have it in place, and then perform antiseptic hand rub hygiene. Now I'm going to raise the bed to working height and lower the side rail, and then position the patient comfortably. Now I'm going to don my goggles and clean gloves. Next, I'm going to carefully remove the outer dressing while maintaining, first I'm going to expose the suture line and the wound, carefully rolling back the gown and the blanket, ensuring that I maintain the privacy of the patient. Then I'm going to carefully remove the outer dressing, gently pulling outward toward the wound. And then I'm going to put the dirty side away from the patient. Now I'm going to assess the secondary dressing, noting any type of drainage, any amount of drainage, any color of drainage, any consistency of drainage, and also any odor of the drainage. Next, I'm going to remove the inner packing and the 4x4 that was under the ABD pad. Now I'm going to observe the wound, looking for any granulation, any necrotic tissue, also any slough or odor. Now I'm going to gently palpate the wound, looking for any redness, any edema, and asking Mr. Jones if he feels any tenderness. That being said, I'm now going to dispose of the dressing into my clean gloves, downward towards the trash can, glove to glove, and skin to skin. I would also like to note during this time that my workspace that I will be using my supplies on should be at waist level. It is above waist level due to different conditions right now, but it would usually be at waist height. I'm now going to open the contents of my dressing change tray. And then remove my sterile field. There is a 1-inch border around my sterile field, so I need to keep all of my equipment away from it, and also any of my sterile field hanging off the edge is now deemed insterile. Next, I'm going to dump my sterile kit onto the field. Careful not to touch it. After I've done this, I will grab my saline bottle and I will inspect the expiration date. I see that it's not expired. I will remove the cap carefully, pointing the cap up, and slowly pouring saline into the dressing change tray, carefully trying not to splash the sterile field. I've done that palming the label. Now I will recap the saline and set it aside. Next, I'm going to don my sterile gloves. Carefully gloving inside of the cuff with my non-dominant hand, I'm inserting my dominant hand into these sterile gloves. Inserting my gloved hand under the cuff to ensure sterility. I will now put the cuff on my non-dominant hand. Keeping my thumb away from the glove. And reposition the gloves on my hands. Next, I'm going to rearrange the items on my sterile field, placing 5 pieces of gauze into the saline to be moistened. 2, 3, 4, 5. And then going to observe the suture line. I see that is approximately 7 inches in length. I'm also going to note the approximation of the edges and see if the edges of the suture are touching each other. And I'm also going to note any drainage from the suture line. Now I'm going to grab a moistened gauze pad, carefully wring it out, and position it so that my gloved hand will not touch the suture line, and I'm going to clean from the least contaminated to the most contaminated, starting at the suture line. And then carefully disposing above my waist into the trash can. Then likewise, I will clean the sides of the suture line, which are considered the most contaminated. That's the other side of the suture line, disposing above my waist. Now I'm going to, using a sterile piece of gauze, pat dry the suture line. And then dispose that above my waist. Next, I'm going to carefully pack the wound. To do this, I will grab a moistened piece of gauze, carefully wring out, and then I'm going to now fluff this piece of gauze. After I fluff the gauze, I will carefully place it into the wound. After fluffing, I'm going to place the moistened gauze into the wound until it has been filled. Now I will cover the wound with a 4x4 piece of gauze from my sterile field. Next, I'm going to apply my ABD pad, which is makeshift in these times, to the outside of the wound. Next, I'm going to remove my sterile gloves into the trash can, downward, glove to glove, and skin to skin. Next, I'm going to grab some tape and carefully measure into each side. And tape it. All the way around the edges. Normally in a hospital setting, I would get another piece of tape and tape it to the outside of my ABD pad. And on this piece, I would write the date of the procedure, the time of the procedure, and also my initials. Now I'm going to reposition the patient for comfort. They have been repositioned, and then I'm going to lower the bed and then raise the side rail. Then I would perform hand hygiene and then dispose of my supplies. When I would go back to the nurse's station, I would document the assessment of the suture line, my assessment of the wound, and then I would also document how the patient tolerated the procedure.